Hello friends, let us now learn some important points about the normal thyroid parenchyma. So if you see, this is the picture showing normal thyroid parenchyma. This is actually derived from this paper. So normal thyroid parenchyma is actually homogeneous, right? It has the same color. It is completely with the same color. So it is homogeneous with medium to high level echogenicity is present. And if you see, this is thyroid, this is one lobe, this is the second lobe, this is isthmus. Okay. Now, if you carefully observe that, you will find that surrounding the thyroid gland, you will see a hyperechogenic line which is seen. See, this is hyperechogenic line which is seen surrounding the thyroid gland. So this hyperechoic line which is seen surrounding the thyroid gland, this line is nothing but the capsule of the thyroid gland. Thyroid gland is surrounded by a capsule. So this hyperechoic line surrounding the thyroid gland is the capsule of thyroid gland. This capsule might become calcified in certain conditions. Especially this capsule is calcified. That is, in such cases, we will have calcified capsule. This calcified capsule is seen in conditions of uremia, where there is renal failure causing uremia, or it can also be seen in calcium metabolic defects. Also, we can see the presence of this calcified capsule. Now, if you see, if you put the Doppler, high power Doppler to the thyroid gland, you will see that on using the power Doppler to the thyroid gland, as we have already said, the thyroid gland has rich vascularity by superior thyroid and inferior thyroid arteries. So you can see the color uptake which is seen in power flow or high power Doppler. Okay. Now, we have said that there is superior thyroid artery and inferior thyroid artery and superior thyroid vein and inferior thyroid vein. These are the blood vessels which are surrounding the thyroid gland. So first we will see superior thyroid artery. So this is the picture showing the thyroid gland. Okay. This is the thyroid gland and so this is the thyroid gland and this is the superior thyroid artery. If you see here, see this one is the superior thyroid artery. Okay, this is the thyroid gland. This whole is the thyroid gland. This is thyroid gland. Okay, then superior to the thyroid gland here, you can see the superior thyroid artery. If you see the superior thyroid artery and putting the waveform, you can see the pulsatile velocity of the blood flowing through the superior thyroid artery can be assessed. Then we have inferior thyroid artery. Yeah. So this is also the picture. This is the trachea, right? You can see the trachea here, right? This is the trachea. Okay, this is the thyroid gland. Okay, this is the carotid artery. This is the internal thyroid, inferior thyroid artery. So here, this is the inferior thyroid artery, which is seen in the picture. This inferior thyroid artery is present inferiorly or below the thyroid gland, in the lower pole of the thyroid gland. It is present in the lower pole of the, or actually not lower pole, it's in the lower third or posterior to the lower third of the thyroid gland. This is the picture showing the inferior thyroid vein and this is the pulsatile inferior thyroid vein. Now, in the inferior thyroid vein is actually located at the lower pole of the thyroid gland. Now, this is the pulsatile flow of inferior thyroid artery. Okay. So this is inferior thyroid artery. This is the pulsatile flow which is seen in the inferior thyroid artery. This is inferior thyroid vein with the flow, Doppler flow which is seen in the inferior thyroid vein. Now if you see the mean diameters, the mean diameter of artery is around 1 to 2 mm. Okay, whereas the mean diameter of the veins is around 8 mm in diameter. Veins are 8 mm in diameter, whereas arteries are around 1 to 2 mm in diameter. Whereas if you see the peak systolic velocity of major thyroid arteries is around 20 to 40 centimeters per second. Whereas peak systolic velocity of intraparenchymal arteries is around 15 to 30 centimeters per second. So the peak systolic velocity is highest in um, organs which are supplied by more blood vessels. That is, superficial organs have higher peak systolic velocity. Okay. Then this is the way of um, visualizing the thyroid gland. So if you see, this is a transverse view of thyroid gland where this is the linear probe. If you see here, this is the linear probe which is put in a transverse view. That is, it is put across the neck. So this is transverse view. This is put along the neck. So this is a longitudinal view of the thyroid. Okay, this gives mediastinal or anterior mediastinal view of thyroid, where angling the probe like this, we will help to find out the mediastinum. Whereas this is behind the trachea. So this is retrotracheal section of the of putting the probe, placing the probe so that the thyroid gland can be visualized. So if you see the ultrasound view, so this is what you see in the ultrasound of thyroid gland. The thing that you have to remember in ultrasound of thyroid gland is mainly the labelings or identifying the structures. If you ask me, only and only when you are able to identify the normal structures, then you can identify the pathology. If you don't know what the structure is, then obviously you do not know the pathology of that uh, um, part, and thus you cannot identify the deformity or abnormality. So if you see, um, so here this is the picture. Okay, this is the skin. Superficial part is the skin, followed by the platysma muscle. So this is skin. This black color you can see here like this, right? This is platysma muscle. Skin followed by platysma muscle. Below the platysma muscle, we have this whitish line here like this whitish line. This is actually the fascia. Okay, this is the fascia cervicalis, that is fascia of the neck. Below that, here you have this muscle. Okay, and this muscle. This is sternohyoid muscle. Below that, we have sternothyroid muscle. Okay, so this is sternohyoid muscle, and below that we have sternothyroid muscle. So what are they? We have skin. First superficial structure we have skin, followed by platysma muscle. Then we have fascia cervicalis. Then we have two muscles. One we have sternohyoid muscle. Then we have sternothyroid muscle. Okay. Then we have right lobe of thyroid, left lobe of thyroid, and isthmus. So anteriorly to the thyroid, we have two muscles: sternohyoid muscle, sternothyroid muscle. More anterior, we have fascia cervicalis, platysma muscle, and the skin. Okay. Then this is the carotid artery which is seen on either side, and this is the internal jugular vein which is seen on either sides. Okay. Then we have longissimus coli. So this is the longissimus coli muscle. It is also a muscle which is seen behind the thyroid. So behind the thyroid we have two muscles, longissimus coli muscle, and this is the esophagus. Okay, so this is the main ultrasonographic picture of thyroid gland. So this is transverse view. Then we also have longitudinal view. So in the longitudinal view, again we'll have skin, then we have platysma muscle, then we have fascia cervicalis. See, this black one is platysma muscle, which is nothing but the muscle. This white one is fascia, which is fascia cervicalis. So below that, as we have already said, in front of the thyroid, we have two muscles, that is sternohyoid muscle and we have sternothyroid muscle. So there is sternohyoid muscle, SH here is sternohyoid muscle, this one, and then we have sternothyroid muscle. And obviously this is the thyroid lobe, okay, and posterior to the thyroid lobe we have longus colli muscle, okay. Then this is the picture which is also an anatomy, okay. Here you can see this structure. This is nothing but the recurrent laryngeal nerve. Okay, this recurrent laryngeal nerve is also in relation to the thyroid gland. So if you see esophagus, here you can see this esophagus also. This esophagus is actually found laterally, that too on the left side. So this is left, this is right. So this esophagus is found laterally and to the left side in the neck, where at the level of the thyroid gland. So these are the some important points about the thyroid gland visualization in ultrasonography. Thank you.